Are you feeling anxious or nervous about your rising PSA levels and the prospect of undergoing a prostate biopsy? In today's video, I'll be sharing crucial information to ease your worries and help you understand your situation better. Now, we'll cover 3 key areas in today's video. Number 1, I'll discuss with you briefly what prostate cancer is and the challenges of early detection. Number 2, I'll also help you understand the limitations of prostate biopsies. And number 3, we'll talk about some non-invasive ways to screen for prostate cancer that could save lives. Now, the prostate gland is part of the male reproductive system. It produces a fluid that nourishes and transports sperm for reproductive process. When it comes to prostate cancer is the development of cancerous cells in the prostate gland. Often, prostate cancer shows no symptoms until later stages. Age, family history, race, and lifestyle significantly influence prostate cancer risk, with older age and family history being key factors. A significant challenge in detecting prostate cancer is the silent nature. In the early stages, the disease may not cause any noticeable symptoms at all. Some men might experience urinary issues as they age, but this can be mistakenly attributed to other causes. Additionally, traditional screening methods using PSA tests and digital rectal exams have shown to have limitations in their accuracy. Because PSA levels can be high for other reasons other than cancer, and not all high levels mean that you have cancer. PSA can also be low when there is prostate cancer. Also, some prostate cancer cells grow slowly and might not cause problems. So it's hard to decide who needs treatment right away. Now, balancing the benefits of early detection with the risk of unnecessary treatment is one of the biggest challenges in managing prostate cancer. Prostate biopsies are common diagnostic tools where a small piece of the prostate tissue is taken and it is checked out for cancer. So if you are told that you're going to do biopsy, that is exactly what they want to do. Now, this procedure can be uncomfortable and it has risks like infection or bleeding, and sometimes biopsies might miss the cancer because they only sample parts of the prostate. Additionally, interpreting prostate biopsy results can be challenging, and sometimes results are unclear or may not fully reflect how aggressive the cancer is. Due to these issues, other tests are often needed, and the whole picture must be considered when diagnosing and deciding on the best treatment for prostate cancer. Diagnosing prostate cancer without biopsy is getting better with new imaging techniques like the PSMA PET scans and MRI, which are proven to be very accurate at finding prostate cancer. PSMA means prostate-specific membrane antigen. It is a protein that is highly expressed on the surface of prostate cancer cells. So, imaging techniques like PSMA PET scans use special tracers that stick to the PSMA proteins, making prostate cancer cells show up clearly on the scan, and this helps to find prostate cancer more accurately. MRI, which is magnetic resonance imaging test, is a way to take detailed pictures of the inside of the body using magnets and radio waves. So for prostate cancer, the MRI can show clear images of the prostate and nearby areas, helping to find tumors and see how big they are and if they have spread. Now, MRI resonance imaging is becoming a game changer. For example, in the UK, MRI is systematically used before biopsies for prostate cancer, which helps to reduce unnecessary procedures. MRI offers non-invasive alternative with high accuracy, potentially reducing the need for prostate biopsies. So what should you do if you have urinary problems or you are worried about prostate cancer? You need to look into your risk and your screening options. Consider non-invasive methods like the PSMA PET scans or MRI, which are the latest way to detect prostate cancer. So, very important now, to lower your risk of prostate cancer, have a healthy lifestyle, healthy diet, regular exercise, and consider supplementing with corpus prostate support, which contains natural nutrients that help prevent an enlarged prostate and help to reduce your risk of prostate cancer. If you found this video helpful, please remember to like, share, and subscribe for more helpful tips. I'll see you in the next video. Thank you for watching.